My name is Jeff DiLullo. I have the privilege of serving as the CEO of Philips North America, leading a dedicated team of 17,000 professionals, many of whom are veterans themselves. Philips is a global health technology leader, delivering AI-enabled solutions in diagnostic imaging, such as MRIs or CT scans, non-invasive cardiac procedures, and patient monitoring solutions spanning from hospital to home. Our mission is to improve the lives of 2.5 billion people per year through meaningful innovation. And nowhere else are we more focused on this mission than in serving America's warriors. At Philips, we get to serve heroes, and we know that. And we do this by putting our innovation to work specifically for the VA. Some examples: a critically needed MRI in the aftermath of a battlefield trauma, helping clinicians to monitor veterans remotely because we know veterans recover better at home, accelerating precision detection and treatment of cancers, and bringing the highest quality cardiac care to our veterans. Our mission is clear: to support the best possible care for those who have defended our freedom. And for me, the mission is also a personal one. I am a graduate of the United States Military Academy. I served as an infantry officer and an Army Ranger. More importantly, I'm a proud father of a soldier. Every morning, my daughter, Emma, dons the uniform of a U.S. Army officer, having answered that same call to serve. At some point, she will rely on the VA for her health care. That's why my work is not work, it's personal. When a veteran walks into a VA medical center today, there's a better than 50% chance they will interact with a Philips piece of equipment. Innovation exists today, commercially, that will improve veteran patient experience, relieve workload on we know or stressed VA staff, and reduce the overall cost of delivering that care. And in several areas of innovation, we are proud to say the VA has already demonstrated a clear leadership. For example, in 2020, the VA implemented, with Philips' help, Telecritical Care Program, or TCC, which utilizes a secure digital infrastructure and network to connect all VA intensive care units. TCC digitally leverages critical care nurses and specialists from other VA locations across the network for real-time support and better monitoring in high acuity settings. The VA has done an incredible job with the TCC program. It's a banner example to any health system, and I talk to every health system in the nation. Better patient care, better staff utilization, it just works. We have something called a Lumify, which, if you can imagine an ultrasound today, an ultrasound can be done on an iPad. They can have a transducer plugged in. I can video in on broadband a technician or a sonographer or a radiologist remotely anywhere. For example, I was in the Kalispell Clinic in Montana this summer. They have no imaging equipment there, but yet it's a large enough facility where you could put an iPad in there and beam in somebody from Fort Harrison from 3 hours away, and I can get a gastro scan, I can get a prostate scan, I can get a liver scan with over-the-shoulder coaching and in real-time results. I can do that anywhere in the country, and we do that in private healthcare.
And have you used artificial intelligence to enhance patient care?
Absolutely. I'll just use that. We could talk for a long time on the ability to enhance imaging and speed the process, but in that particular case, we actually construct the image in AI on the system itself and render a very precise diagnostic. And that's our new opportunities, not just to reach patients, but give precise diagnostics quickly. Rate rapid analysis of threat exposure. Basically, years ago, we started with the Defense Innovation Unit. It takes commercially available devices like this ring that I have on and this watch that I have on, that can record, and other devices as well. They're commercially available, that you can extract about 165 biomarkers, whether it's heart rate, stress level, sleep level, oxygen level, temperature. We've been building algorithms with the DoD for years as a force protection measure to determine when an individual might have a degraded state. Where this becomes particularly applicable over years of building thousands of servicemen and women's data, we've been able to apply algorithms that allow us to determine whether someone will come down with an infection inside of 48 hours or outside of 48 hours from actually showing symptoms. So imagine you're on an aircraft carrier and you have an infection that you haven't shown symptoms yet for a day or two. I can actually intervene and quarantine you and keep the force safe and keep the mission going. We would love to see that kind of speed and innovation working with the VA as well, because we see applications with healthcare providers within the VA, a critical resource and a constrained staff to make sure that if they are about to contract an illness, that they're not, A, passing that on potentially to another veteran that comes into a VA center, or that we see a degradation that makes them vulnerable in an ill population, that we can avoid that and keep them safe and working another day.